Hi, Dr. Kemp.
Hey, how are you doing?
Good. All right, we're going to talk today about opioids and back surgery.
Sure.
We're going to start with a case study. I'm not
Yeah.
going to name the patient, but this is a veteran. Unbelievable story, both of what he was dealing with and for how long and how you helped him. 20 years, terrible back pain stemming from an injury during his service time. For years, right? Decades was told nothing could be done except opioids. And so more and more and more were prescribed. What was the situation for him when he came into your office?
When this patient came to my office, he was dejected. He had no hope. Uh, he had no hope because he'd been seeing physicians all over the East Coast looking for answers, and the answers they gave were often not positive.
And they just said all we can do is prescribe. And I mean, the list of what they'd prescribed: fentanyl, morphine, Percocet multiple times a day, oxycodone 2 times a day. He said if he missed even one pill, he had extreme withdrawal symptoms.
Yeah.
I mean, I find it shocking, all of those drugs added on top of each other. Do you find that shocking?
I wasn't surprised. This type of patient is somebody that we see in my practice often, and it's just a reminder of the failure of the medical system in taking care of these people.
So when he's sitting across from you and he's like, can you, I mean, it's brave to keep asking for help when you've been told for 2 decades no one can help you.
Yeah.
What did you think when he laid out his situation? Did you think, oh, maybe there's an answer here? Or did you think, oh my goodness, there's probably nothing we can do?
Anybody that comes to see me, I try to keep an open mind. I sat down and I listened to him. I wanted to know what his problems were, where was his pain, what were his goals, what were his expectations.
And what did you think after he laid it all out?
I thought, well, let's see what we can do.
You described it to me as like a ball of rubber bands.
Every patient, this patient especially, is like a ball of rubber bands. That's my job to really undo that rubber ball. And oftentimes it just is something as simple as sitting down and just listening to what the patient wants to talk about. Why are they here to see me? And so that's what we did with this patient.
I'm going to jump to the good part, because in the end, you reduced his opioid use by 80% and dramatically reduced his pain. How do you do that? Do you start by saying, hey, let's wean you off the opioids, or do you start by saying, let's figure out what the pain source and do something about that?
It starts with finding out where the pain is actually coming from. Do that with just even a physical examination, looking at imaging, and seeing what the patient has been doing from a treatment standpoint already.
It was complicated with him. There was hardware that had to be removed that people said couldn't. I know you got it removed, which was great. The amazing thing is, as you started to peel away those rubber bands, you discovered that everyone had been telling him for years he had a back problem, and he didn't. What did he have?
He had a problem in his neck, and we were able to take care of him with a much smaller surgery than even he was expecting. And we took away all the pain in his neck and his shoulders with just that small surgery. And that was the process of turning the boat around.
And as you did that, then you could lessen the opioids.
Yeah, it was a very remarkable journey for him. It's one of my proudest moments as a physician, actually.
I was going to say, what's it like for you when you look at what he'd been told and then you solved that riddle?
It's emotionally rewarding in this career to help anybody, but to especially help somebody that's been told by our field there's nothing more we can do. It just shows that oftentimes it going back to basics, being a human being, sitting down with somebody, understanding why they're here to see you, what's been causing them their pain. I think that's one reason why narcotics are given often, is that people aren't willing to sit down and talk to people. Why are they on that medication?
Well, you have to be willing to give the appointment the time too, which not all practices are able to do. All right, so in his case, the solution was tackling the pain. For some people, that might be. For anyone who's getting surgery, I know you give opioids. You have to? Is there nothing other than an opioid after surgery that's going to deal with the pain?
Spine surgery, it can cause some temporary pain. And it's my job, it's my team's job to control that pain, to treat it. By treating it, we actually enhance our patient's recovery.
It's going to supercharge their healing in the long term if you can sort of manage that pain in the short term.
And we have multiple ways of treating people's patient's pain after surgery. That's with mobilization, with physical therapy. Opioids are only a very small part of that that protocol.
So what's the advice for people out there if they're going to have surgery? I know you said sort of the old way of doing it years ago maybe was, here's a bunch of opioids, I'll see you in a month or two. You don't do that anymore.
No.
And I know here at VSI, there's protocols where you've been able to reduce opioid use by 30 to 50% by better estimating what someone's going to need, checking in more often. What are your tips to people if they want to try and avoid an addiction or an overuse situation if they do have to use opioids?
It all comes back to educating the patient even before we operate, right? To inform them that there may be some pain after surgery, but we're going to take care of it. We're going to treat it. And we're going to treat it through multiple different strategies. The narcotics are only a small part of that. And the intention, our goal is not be on it for very long. And we've been very successful doing that.
So the message to people is, if you have to take them, do, but stay in close contact with your doctor.
We're in close contact with them in the period after surgery, up to 3 months after. And our goal is to get them off the medications as soon as feasible.
And if you're a patient like this veteran was, don't give up hope.
Never.